Hi, this is Erica Kingsbury, DNP student at UMass Dartmouth, and this is the PowerPoint for TeachBack. I'd like to begin by thanking you for being such an important part of my project. I know you're most likely doing this during your shift and are super busy, so I can't tell you how grateful I am that you've made time for this. I hope this session will increase your knowledge and confidence using TeachBack with all of your patients. Discharge instructions are one of the most important educational communications between patients and healthcare professionals. The literature tells us how crucial discharge instructions are in regards to patients' ability to manage their illnesses and adhering to treatment regimen post-discharge. When patients are given effective education, an estimated 50% of hospital readmissions and postoperative complications can be prevented. However, the literature also tells us that many patients report confusion with their discharge education, which include their medical diagnosis, symptoms, medication regimen, any follow-up care necessary, and what symptoms to monitor to prevent complications and who to contact should they begin experiencing some of those symptoms. Ineffective discharge education contributes to patients' poor management of their post-discharge recovery. Using evidence-based literature, I have created this short PowerPoint to help you define what TeachBack is, understand how it can be used with all of our patients on discharge, recognize the importance and significance of using TeachBack, increase your knowledge and confidence using this method of education. To support this teaching session, I have included the evidence-based steps to TeachBack developed by the AHRQ that has been posted on the Center for Collaboration, Motivation, and Innovation website. One way to help work around potential problems regarding discharge instructions is to ensure that the patient is fully prepared for discharge and has the knowledge and resources that they need once they are released from the hospital. We can do this by using the TeachBack method. TeachBack has been supported by evidence to help prevent complications after discharge, decrease hospital readmissions, and penalties that the hospital has dealt with as a result of these outcomes. What exactly is TeachBack? The TeachBack method is an evidence-based approach to patient education. This particular method of teaching requires the learners to repeat the information that has been provided for them. It's important for the user of this technique to remember it is not a method of testing the patient's knowledge or their literacy level, but to evaluate the patient's comprehension and how effective the education was that has been provided. The nurse will be able to confirm comprehension of the information immediately and re-educate if needed prior to discharge. It's important for the user of this method to not just repeat the information, but to reword and reteach the information in a different way that the patient can better understand. Here are the steps to using TeachBack, developed by American Medical Association and the Agency for Healthcare Research and Quality. The first step is to teach the patient the discharge instructions. Next, you want to ask the patient if they can teach back the information you've just provided. An example is, I know we've gone over a lot of information. I just want to make sure I'm explaining everything correctly. Could you please repeat back what I've just said? Or you could say something more specific. Because you've just had surgery, you're at risk for developing a DVT or blood clot. Can you repeat back 3 symptoms of a blood clot? The third step is to listen to the patient's response of what they heard and comprehended to see if their understanding of the material coincides with what you've just taught them. The last step, if the patient is able to repeat the correctly information given, then the teaching has been successful. If there is not a shared understanding and the patient is unable to repeat back the information or has repeated incorrect instructions, start with step 1 again. Remember to reword your explanation or add to the information and instructions to make your explanation more clear. TeachBack is a continuum where the educator tells the information, then asks the learner to repeat the important information. The educator then listens to the learner's response to evaluate their comprehension. If the learner has understood the material and has successfully repeated the information, the educator can stop. If the learner has repeated incorrect information, the educator will then go back to step 1 and start over again. This method of teaching can be used multiple times during an education session between you and your patients. This is a resource and a handout that has been provided for you in your email, and it can also be found at www.teachbacktraining.org, which is part of that training module online that I mentioned earlier. It's a great resource. It has 10 elements of confidence for using TeachBack effectively. It's important to use a caring tone of voice and attitude. Oftentimes when we're educating our patients, asking them to repeat back might make them feel as though we're testing them or that we think that they don't understand. And we need to make it very clear that we're actually testing our own education and just making sure that we are explaining everything effectively. Just like we always do with our patients, displaying comfortable body language and making eye contact, using plain language. Instead of using medical terms like DVT, we would say blood clot, just to help the patient understand more. Ask the patient to explain back using their own words. It's important to use non-shaming, open-ended questions. Oftentimes we will ask, did you understand everything? Do you have any further questions? It's important to ask open-ended questions to get more of a response from them, which will help us assess their comprehension. Avoid asking questions that can be answered with a simple yes or no. Emphasize that the responsibility to explain clearly is on you, the provider. Again, we're not testing the patient's knowledge. We're testing to make sure that we're explaining everything correctly and they are understanding everything. If the patient is not able to teach back correctly, explain again and recheck. Using reader-friendly print materials to support our learning, and document the use of and patient response to TeachBack. It is important to write a note when we are educating our patients, and I do believe that eventually ATWID 3 will also be expected to document the use of TeachBack as part of their JCO accreditation. So why is using TeachBack so important? Why should we be using this method of teaching with our patients? Remembering what I said in the first slide about how important discharge instructions are in regards to the patient's ability to manage their illness and treatment regimens post-discharge, the literature also tells us that patients report confusion in their discharge instructions, and this includes anything about their medical diagnosis, their follow-up care, any post-operative care, and all of this has been supported by returned patient surveys right here at Charlton. Patients immediately forget between 40 and 80% of the medical information they receive during office visits, and almost half of the information they do retain is incorrect. A substantial percentage of hospitalized patients do not understand their plan of care or discharge plans. When patients actually don't understand the information, they are often reluctant to admit that they have not fully understood all of the information provided. Discharge instructions are automatically generated based on their diagnosis. They are usually not patient-specific. Oftentimes, healthcare professionals will use medical jargon that they assume that the patient understands instead of using simple layman's terms. The patient's health literacy levels can affect their comprehension of the instructions, and we do not perform any assessment or utilize any tools to assess their level of literacy prior to discharge. Patients may not be ready to learn because they don't feel they're ready to be discharged, or on the other hand, they may be in a rush to leave. They're not quite listening to everything the nurse is explaining to them, or maybe they're anxious about being discharged. All of this is supported in the literature as well as during the unit assessment of one of the units at Charlton that I conducted prior to implementing my project. I hope this educational session was helpful in increasing your knowledge and confidence using TeachBack with patients on discharge. Please click on the link below in the video description to complete the post-knowledge survey and post-confidence survey. Please call or email me with any questions or concerns. And don't forget to ask your charge nurse, team leader, or nurse manager to enter your email address into the drawing to win a $50 gift card. Thank you.